Are you keeping a log of all HIPAA disclosures you've made for the past 6 years? Because patients have a right to request it and you must give it to them within 60 days. So it's not every disclosure, and let's go into the details about what that means for you and how you can keep this log in your practice. I'm Scott Radigan, and if you're new here, I'm the founder of Functional Lawyer. And let's talk HIPAA, everybody's favorite subject today. So in HIPAA, we have something called disclosure accounting. And I know most people aren't familiar with this if they're brand new to having their own practice or are brand new to not having a whole HIPAA department for them. But HIPAA disclosure accounting is not financial. It is accounting, the action or process of keeping records of particular disclosures. These are sometimes referred to as accounting of disclosures or AOD. And most entities will keep them in a log, either a spreadsheet or a written log in Word, like a word processor format. So every disclosure, like what's included in this log, every disclosure that's made for purposes other than treatment, payment, or healthcare operations. So that's TPO. Often you'll see that shortened to TPO. So within the context of disclosure accounting, those that where the patient has asked for it themselves, and there's a few exceptions to this. So we'll go into all of the exceptions as well. But disclosure is defined as access to, delivery of, or transmission to parties that do not have authorization to have access to those records, whether they have a business associate agreement with you, that's okay. Or if it's through treatment, payment, or operations, that's okay as well. And then additionally, if the patient has given you written authorization to share it, you don't have to log that in the accounting log because you will keep that written authorization in that person's file, right? So let's talk about what treatment, payment, and healthcare operations mean. From the Department of Health and Human Services, or HHS, here is some of their guidance, though the actual language in the Federal Code of Federal Regulations will actually control. But HHS's guidance includes treatment means provision, coordination, or management of healthcare and related services amongst healthcare providers or by a provider and a third party, consultation between healthcare providers, or the referral of a patient from one provider to another. So that's treatment, talking basically provider to provider. Payment encompasses the various activities of healthcare providers to obtain payment or be reimbursed for their services, and of a health plan to obtain premiums, to fulfill the coverage responsibilities and provide benefits under the plan, and to obtain and provide reimbursement for the provision of healthcare. So largely there is the insurance industry. So the insurance carriers are subject to HIPAA as well. And also you as providers or covered entities, if you're interacting with healthcare insurance companies to get reimbursed, or if you are reaching out to the patient or maybe a patient's personal representative to obtain payment, that would be a payment disclosure. And then healthcare operations are certain administrative, financial, legal, and quality improvement activities of a covered entity that are necessary to run its business and to support the core functions of treatment and payment. So those are the ones that you don't have to account for. When is accounting of disclosures necessary, and what you need to put on the form? It's necessary if you disclose patient records for the purposes of selling them, for scientific research, or if the data has not been de-identified, if the client has consented to having their information included in a client marketing story, or if their information has been disclosed for other marketing purposes, as well as these following categories that are also required to be accounted for in this accounting of disclosures. So those that are required by law, including court orders, subpoenas, state reporting, and/or emergencies, public health activities like the pandemic that we just talked about for the last 3 years, prevention of disease, public health investigations, victims of abuse, neglect, or domestic violence. If you have to share information for any of those reasons, you should account for that in your log. Health oversight activities from HHS, FDA, or Medicaid fraud, Medicare fraud units, decedents, so coroners, funeral directors, personal representatives, research purposes, averting serious health or safety threats, terrorism, communicable disease organizations like the CDC, specialized government functions if they are in the military, so check with that, workers' comp, and then maybe even accidental disclosures as well. Usually this shouldn't be a huge part of your normal HIPAA routine, but you need to be aware of it because patients, as I said at the outset, have a right to request it, and they have a right to request it for up to 6 years prior to the request. So you shouldn't make disclosure outside of payment, treatment, or operations part of your practice, but when it does happen, and it inevitably will, now you know exactly what to do for those disclosures. So if you don't have an accounting for disclosures log, it ought to be part of your HIPAA policies and procedures manual, which is a requirement under HIPAA as well. If you don't have that, we have a template for that at Functional Lawyer that you can then work with your legal representative and often your IT professional for the security rule in order to put that in place and customize it for your practice. So takeaways from today. Disclosure accounting log or accounting of disclosures is a requirement under HIPAA when you disclose PHI for purposes other than treatment, payment, or healthcare operations. You're required by law to provide patients a list upon request of all disclosures of their PHI outside of treatment, payment, operations. And ideally, you won't have too many of those on the log, so it shouldn't be a huge burden for you to comply with this as well. There you have it. That is the accounting of disclosures, kind of an arcane area of HIPAA, but very important and required nonetheless. If you have any questions, reach out to us at Functional Lawyer, and we'll see you guys in the next video.